Joining me now is the Secretary of the Veterans Administration, Secretary Wilkie. Welcome to the show. Sir, great to have you on again.
Well, John, thank you again. And, had you started covering the president's press conferences yesterday, you'd have gotten me for you'd have had me for entertainment yesterday. But I'm glad you're doing it, and I certainly agree with you about the issues the matters that you just raised in terms of folks covering what the president has said, and I appreciate everything you're doing.
Mr. Secretary, it's the President of the United States. I don't care if you
That's
agree
right.
with him or not.
Absolutely.
But if he's having a press conference during a pandemic where 10 million people just filed for unemployment,
Right.
10,000 people died, and you're not going to cover it?
That's right.
And you're funded by taxpayers?
Yes.
I mean, you got to be kidding me.
Absolutely. Let me digress for a minute. You're talking about President Trump and what he does and the power that he has unleashed on this. From a veteran's perspective, I'd been the Undersecretary of Defense when he asked me to come over here, and I was amazed at how much time he spent with me talking about veterans, talking about military service. And he has allowed me to present the two largest budgets in the history of this department. He's the first president who's ever campaigned making veterans the central theme of his campaign, and then fulfilling that promise in the White House. And as you were mentioning Granby Street. I went to school in Norfolk for years. At the Catholic schools in Norfolk, and know that area. Most veterans in the country in that Hampton Roads area, but when we look at the number of veterans across the country, Virginia's 5 in our new numbers and catching up on California. And the beauty of that is you don't have to explain military service to anybody in the Commonwealth. And I thank you for what you do to get the word out to veterans.
Well, thank you, Mr. Secretary. And I want to talk to you a little bit about what the VA is doing right now, how it's interrelating with treating veterans for coronavirus and other ailments that they have. Can you elaborate on that, sir?
Well, we were the first health network in the country to do things like stop elective surgeries. We were the first ones to actually stop visitors from coming into the facility. We tested everyone before they went into the facilities. We had to make a very tough decision, John, when we closed off our assisted living centers, our nursing homes, to family and friends, because the majority of those veterans in those nursing homes are from World War II and Korea. So we have done that. Interestingly enough, in Virginia, we have not been hit hard for veterans. Norfolk is the most with 16, but McGuire, I'm looking at McGuire right now, and there are 5 veterans in the hospital, and Salem doesn't have any. But we have been preparing since the first week of February in a way that the rest of the country wasn't, at least to the private medical sector. And we have been providing those services to veterans, and that allows us to fulfill our 4th mission, which is what I talked about with the president yesterday, where we have excess capacity. We can provide a bridge between the federal government and the states and localities. For instance, New Orleans is incredibly hard hit. There are more veterans tested positive for the disease down there than there are in metropolitan New York. But in order to help the state, we opened up the Shreveport Veterans Medical Center because there just aren't a lot of veterans in there right now. We just took on a national pharmaceutical mission to support FEMA, HHS, DOD, and the Coast Guard with the purchasing and contracting for pharmaceutical supplies. So we are doing our veterans mission first. That's the priority, but we also will fall in when the president calls us to perform a national mission.
All right, so let me get this straight, Mr. Secretary. We're with the Secretary of the Veterans Administration, Secretary Robert Wilkie. Secretary Wilkie, let me get this straight. So what you've done is in areas where you've had You've asked veterans to not do, for now, elective surgery.
Right.
And then in certain VA hospitals, that has opened up a number of beds.
Right.
And so you've then made those beds available to veterans that have been diagnosed with the coronavirus. Is that also open to just all people or just veterans?
Just so, well, first of all, we take. I know there's been a lot of discussion about the last week comfort not taking people with COVID. We take COVID, non-COVID. In New York, we've opened up 50 beds in Brooklyn and Manhattan because we just don't have a lot of veterans in the hospitals up there. And those are open when the state or the local authorities ask us to accept someone if that's COVID or if it's non-COVID. The same in East Orange, New Jersey. We've done that. We just moved in and trying to save 2 nursing homes in Massachusetts that were in danger of collapse because there was no other way to help people. Again, we take care of the veterans first, but this fourth mission is this national mission that we have when the president calls us.
It's amazing what you guys have done. You know, Mr. Secretary, I think I've had this conversation with you before, but we covered the VA and what was going on with the scandals and everything else. I mean, I covered it every week for it seemed like a 4 or a 5 year period.
Yeah,
every week there was another scandal. Yeah, there was another problem. We would have veterans calling our show that were just beside themselves. They couldn't get in. They couldn't get a phone call returned. You know, and in this short period of time, you completely turned it around where now you're making beds available to other people that need one in some of the hotspots, and it's certainly Shreveport being one of them.
Right.
And they kept telling us like it couldn't get done, right? And remember we passed the Accountability Act and all that. Yeah. They kept telling us it couldn't get done. How are you guys able to do this so fast?
Well, I'm going to give the first credit to Donald Trump. He brought a businessman's sense of urgency to this department. And you just hit on accountability. We've released over 8,000 people in the time that I've been here. And that's everybody from the senior leadership here in D.C. to medical center directors, network directors. And that sends a message to the entire workforce that there are no different spanks for different ranks, as we say in the military. So that's one. The other thing was to get, and this is something you and I share the same political philosophy, to get the day-to-day decision-making out of this headquarters and give it to the people who are actually doing the frontline work. That, Jefferson talked about the only kind of efficient government is the government that's closest to the people, in this case, the people we serve. And that has changed course. So I'll also mention that since Donald Trump became president, we have the highest trust scores in the history of this department, 88.9%. That's unheard of in any medical organization in this country. The VFW just finished its national survey, and they're the second largest veteran service organization, and their members have a 90% approval rating. What he did went down the chain to all of our hospitals and all of our clinics, and it's seen on a daily basis. And so I still serve. I'm a colonel in the Air Force Reserve still, and I can tell you that wearing that hat, I appreciate what he's done.
There's talk, and then there's results.
Yeah.
And what you guys have gotten as far as results for our veterans compared to where we were is amazing. You're on the John Fredericks Radio Network, Trucking the Truth Across America. I am with the Secretary of Veterans Affairs, the Honorable Robert Wilkie. By the way, he was nominated by President Trump to serve as the 10th Secretary of VA and confirmed on July 23rd, 2018. So he's been there coming up on about 24 months. Mr. Secretary, what is your message to veterans listening to us today? If they're diagnosed with COVID-19, what do they do? What happens?
Well, let's get to the point before they're diagnosed. If a veteran does not feel well, if that veteran has a fever or a cough call us. Don't come in. We don't want to endanger you or your fellow veterans or our employees. Call us, and we will point you in the right direction. The other thing I want people to do, and the military is a family, John. We're the only profession, really, and maybe police and firefighters. I'll say that, but we're the only other profession where when someone signs on the dotted line, the entire family goes with that person. So we ask families and caregivers to call us if they have any questions or concerns. That's 800-273-8255. That's our Veterans Crisis Line. There's no voicemail. The wait time is between 8 and 12 seconds before someone picks up. Call us, tell us what's bothering you, tell us if you need something, and we will work that. The other thing I ask them to do, if they have a computer, is go to va.gov, click on the banner at the top, and that will get you information on how to send a secure message to us so that we can act on that. I mentioned, and you mentioned, we stopped routine visits, we stopped elective surgery to protect not only veterans but our people, and also to prevent the wear and tear on our equipment and things like our blood supply, to make sure that was stable. Hard decisions, but in terms of providing for the safety of veterans, we had to do it.
Mr. Secretary, can you give us that 800 number again?
Sure. It's 800-273-8255, or folks can text to 838-255.
Okay, 838-255 is a text, or they can call 800-273-8255. They have a question. If you have a fever, you're coughing, you're a veteran, you think, maybe I have this.
Yeah, or where you're sitting, John, you can call McGuire VA, you can call the Hampton VA, Salem VA. For our combat vets, the Richmond Vet Center, Roanoke Vet Center, that's where our combat veterans go. Call them. They'll put you in touch with the right people, too.
What has been the flow of COVID-19 patients you have?
Let me give you the numbers. So we serve 9.5 million veterans across the country. We have had so far 2,800 veterans test positive. Of those 2,800, 2,100 are at home. Sadly, 125 have passed away, which leaves little less than 600 veterans who have the virus who are in our facilities from Alaska down to Puerto Rico. The hardest hit VA center in the country has been New Orleans. The numbers there are staggering. 410 in New Orleans, and you compare that with about 350 in metropolitan New York. And New Orleans, since Katrina, is not one of the 50 largest cities in the country anymore.
Right.
But in Virginia, looking at the numbers, Hampton has six. Actually, I'm sorry. Hampton has got 17 veterans in the hospital. Salem has none, and Richmond has 5. So we are well under capacity in those hospitals, and we've been clearing beds for the last month to make sure we have enough in the event that we do get a wave in places like Virginia or even in California.
Right, because the whole thing is the spike, right? I mean,
right, that's right.
Everybody knows now this virus, we're going to have to live with. It's going to go on for a while. But the whole thing is having enough beds available for those who may need them,
yes,
and
sir.
to, as they say, flatten that curve out so that we're not overwhelmed. Certainly you're in good shape in Virginia. It sounds like in New Orleans you've had to now bring some of your vets to other locations, whether it be Shreveport or whatever.
Or Mississippi,
Right, or Mississippi. But, I mean, you pretty much have this handled. You look at the Commonwealth, you got a total of 22 people in the hospital, 22 veterans in the hospital with COVID-19, so you have, capacity there. Let's hope, you don't need the capacity.
That's right. Absolutely.
Let's hope you don't need it.
That's right.
So 9.5 million vets that you've got in the system, and 2,800 have tested positive. Right.
And we've tested close to 20,000 vets for the disease, and so you see where the numbers are for our vets.
When you test a vet, is that random, or is that somebody that comes in and says
no?
Needs a test?
It's usually there's a cause.
There's a cause, right? Like I have a fever, I have a cough, I might have
or they've told us, guess what? I was in Venice, Italy.
Right.
Right,
exactly.
Yeah.
Or
right.
I was in contact with somebody that I'm aware that had it.
Or sadly, I was at Mardi Gras.
Yeah, exactly. Well, that was been the issue there. I tell you what, Mr. Secretary, I want to thank you for the great work that not only yourself but your entire team has been doing for our veterans.
I thank you for saying that, John. We've lost 3 employees to this. People who are in the front lines in Indianapolis and Detroit. And so I thank you, and I thank you for standing up for the cause.
Well, it's getting tougher. We've got to stand together here, and you got to call this stuff out. And I know I started on the NPR rant, but, what that $50 million has to do with saving someone from COVID-19 or from helping somebody pay their rent, I have no earthly idea. What I do know is the day after they took the money, they took the president off the air doing his daily press conference. I mean, it's outrageous beyond belief. I mean, they're funded by the taxpayers, and they're not carrying your press conferences. Yeah. Unbelievable.
Yeah. Yes, sir.
Unbelievable.
Well, thank you.
All right, sir.
It's good to talk to you, and call me anytime. I'll do my best to stop what I'm doing and come on.
All right, sir. Thank you so much.
Thanks a lot,
Secretary of the VA, the Honorable Robert Wilkie. You're on the John Fredericks Radio Network, trucking the truth across America.